Okay, guys, time to get real. My name is Roy, and I'm a satisfied customer of testosterone replacement therapy. But you got to deal with one thing that might be a little scary, and that's needles and injecting yourself. Got to say, I don't like admitting I'm afraid of anything, and maybe you're like me that way. But it did take me a while to get over the idea of jabbing myself in my leg with a needle. I'm here to say that you can get used to it, and you can get over the hump, and I want to help you do that. This video is going to show you how to prepare everything to do an injection, how to actually do it, and what to watch for afterwards. Even if you're not anxious about injecting yourself, I suggest you watch this video to make sure you're doing everything safely and effectively. Trigger warning, this video will show an actual injection. So if you're terrified of needles, I suggest you stop watching now and look into getting a topical cream instead. Very important, you want everything to be clean, including yourself. You got to wash your hands thoroughly before you do the injection, and I recommend you do it right after you shower. You're going to inject yourself in your thigh muscle, so you need to wear something that will allow you to access that area of your leg easily. Find a quiet place where you can sit comfortably and without interruption. Arrange the vial, alcohol wipes, and a fresh needle on a clean surface nearby. You'll also need the sharps container for the used needle. Let's walk through each step in preparation for the injection. Remove the wrapping from the syringe, but don't take the plastic needle guard off just yet. Get 2 alcohol wipes ready to use. Remove the safety cap from the vial and discard it. Don't touch the permeable membrane on top of the vial. Go ahead and uncover your thigh. We use the thigh because it's a place you can easily reach to do the injection yourself, and you're not likely to feel much pain. Before we go further, let's make clear 2 things. First, you might feel a bit of pain and soreness, and secondly, you might see a bit of blood. These are totally normal, and it's not guaranteed you will, but be prepared. The first time I injected myself in each leg, I was sore for a couple of days. That may not happen to you, but you probably don't want to do it right before you run a marathon or take a long hike. At least for me, after that first injection in each leg, I didn't feel that kind of soreness again. Okay, you're set up to give yourself the injection. The vial, the alcohol wipes, and the needle are close by, and your thigh is exposed. The injection site is between the middle and outside of your thigh, at least 1 hand width up from the groin and 1 hand width down from the knee. Not directly on top of the thigh and not too close to the knee or hip. The muscle you're injecting into is called the vastus lateralis. Go ahead and check a few times exactly where you want to do the injection. Now take one of the alcohol wipes and clean around the injection site. Let it dry thoroughly. Do not touch this area after you've wiped it. Take the other alcohol wipe and clean the top of the vial. Let this dry thoroughly as well. We're getting close to the big moment. Take a few deep breaths and relax your shoulders. Verify the dosage of testosterone that's been prescribed for you. It should be in milliliters or ml. It takes a bit of concentration and patience to draw the testosterone from the vial. First, remove the needle guard from the syringe. Be careful, of course, not to poke yourself with the needle or touch anything else with it or bend or break it. If any of those happen, discard the syringe and needle in the sharps container and get a fresh one. Pull the plunger on the syringe to the dosage mark so it fills with air. This will help get the fluid out more easily. We'll use 1 ml for an example. Your dosage may be different. Take the vial and turn it upside down, then from below the vial, push the needle into the vial and inject the air. Make sure the point of the needle is in the fluid inside, not in the air inside. Now pull back on the syringe plunger to your dosage mark plus a little extra. Keep the point of the needle in the fluid as it slowly fills the syringe. Now that it's filled, let's clear out any big air bubbles. Tap the barrel of the syringe lightly to merge the bubbles, then push the syringe plunger gently to push the bubbles back into the vial. You might need to overshoot your dosage a bit so you have more fluid to work with. It's okay if there are a few small bubbles in the syringe, we just want to minimize them. After your syringe is filled, carefully pull the needle from the vial. Don't touch anything with the needle. The time has come. The big moment is here. You can do it. Take a few deep breaths and relax your shoulders. Remember where your injection site is, within the area you cleaned with the alcohol wipe. You want to inject yourself at a 90-degree angle from the skin, not straight up and down or straight left or right. Hold the syringe like you're going to throw a dart. Take a moment to hold it like this so it feels comfortable. The injection is called a jab for a reason. You don't want to be too forceful or not forceful enough. Imagine tapping somebody on the shoulder. That's about how much force you'll want. Here we go. Holding the syringe like a dart with the needle 3 to 4 inches from your skin at a 90-degree angle, jab it into your thigh. Because this is going into muscle, this shouldn't hurt too much. If your leg twitches a little bit, you might have hit a small nerve going in, but that's nothing to worry about. The hard part is over, but there's still more work to do. If your needle isn't all the way in, just push it in gently until it is. Now for the actual injection. Don't rush this. Hold the body of the syringe with one hand while slowly and steadily pushing the plunger with the other until the plunger stops. This is thick fluid going into deep muscle, so it'll take some effort. Now slowly pull the needle back out at the same 90-degree angle. Once it's clear, immediately push the used needle into the jabs container, making sure it's completely inside. If there's any blood at the injection site, clean it with an alcohol wipe. You can apply pressure as well and a Band-Aid if necessary. Now remember, you may feel a little sore for a few days after the injection, especially if it's the first time you've injected that leg. If you go slowly and follow directions, injecting yourself is very safe. But here are a few things to watch out for, especially bacterial infection. As I said earlier, don't touch the needle against anything, and if you do, get rid of it right away in the jabs container, and of course don't use a bent or broken needle, and under no circumstances should you reuse a needle. If you notice after injecting yourself that around the site of the injection there's redness, swelling, pain, or warmth, you need to monitor it closely, and if it doesn't get better, go see a doctor. A bacterial infection can lead to abscesses and even sepsis, which is an infection of the blood. This is not good, so keep an eye on it and get to a doctor if you notice things are going that direction. If you feel a mild jolt or shock when you inject yourself, that's normal. You probably just hit a little nerve. But if you feel a super strong electric shock or jolt, and your instincts say, pull the needle out, pull the needle out. The thigh is a very safe place to do an injection. In other locations, it's sometimes recommended that after the jab, you pull the plunger out a little bit to make sure you haven't gotten the needle into an artery. This really is not a concern in the thigh. Be sure to watch our other videos about testosterone, including learning about side effects that might cause you to need to get medical attention. You've learned about the benefits of testosterone supplementation therapy: greater competitiveness, increased muscle mass, more energy, and higher libido. By learning how to inject yourself, you're on the path to enjoying these benefits. Visit our website for more health resources. We wish you good luck and happier and healthier days. Thank you.